Good afternoon. My name is Alex Sandoval. I'm an MSN student at Liberty University, and this is Health Policy. I'm going to talk to you about a bill that has been introduced. However, it is still waiting to be agreed and to be passed. The bill is S 953 and also called Rural Health Innovation Act of 2023. Well, I'm going to start by telling you that this bill was introduced by s- Republican Senator Marsha Blackburn in collaboration with Democrat Senator Hickenlooper. Senator Marsha Blackburn is from the state of Tennessee, and Democrat Hickenlooper is from the state of Colorado. It is important to note that there's a collaboration here between the two parties. I'm gonna explain to you why in the a little bit ahead. Well, this Rural Health Innovation Act proposes to establish two grant programs to increase access to emergency care in rural areas. The first one is a grant of $500,000 for already established rural health centers with aims at improving access to emergency care. And the second one is of 750,000 to establish a new health center or a new rural health clinic with emergency care services. It is important to note that there's a limit of 25 million for fiscal year for this purposes. When I look for the history of the build, I couldn't find much information. However, we delved into resources such as the Congress.gov or the website of Senator Marsha Blackburn, given her sponsorship. And we noticed that this bill has been linked to another bill called 1712. This bill was marked as identical. In our investigation, we included a review of studies that explored implications for rural healthcare access. So, in these documents that we found, we noticed that from 2010 to 2019, about 130 rural hospitals closed. This is according to a study that it was done by the College of Nursing Tennessee. And even when hospitals remained open, they had to close some critical services such as obstetric care. In 2019, 64 of the non metropolitan counties were designated primary health professional shortage areas compared to the 41% of metropolitan counties. This is according to the American Journal of Public Health. So, as you can see, there was a disparity here, and many of the documents that we noted, that we read, we noted that there's this really underlined disparity between the healthcare facilities in rural areas compared to the urban areas. The context of the build, as I mentioned it, the build S953 was marked as an identical bill with the HR 1712. This bill was introduced in the House of Representatives, and it was introduced by Republican Representative Gustav in collaboration with Democrat Representative Custer. Once again, we see right here the collaboration between a Democrat and a Republican, and this gives us a little bit of wider perspective that um, the need is so great that there's a collaboration between two parties to try to find a fix for this problem of the rural healthcare services. According to the Center for Healthcare Quality and Payment Reform, over 300 rural hospitals are at immediate risk of closure due to inadequate revenues to cover their expenses. So we noticed that yes, there's about 300 that are at immediate closure. However, that is basically the like the tip of the iceberg. Uh, the same document states that 600 rural hospitals are closing and 300 are at immediate risk for closing because they have more debts than assets. So, what are the benefits of this bill? In case that this bill passes and becomes a law, then the grants that will be given to a certain amount of hospitals. So these hospitals obviously will help the population. So we can say that the benefits will impact the population. However, we the impact of the helps of the benefits of this bill is not just the population, but the entire industries that are usually located in rural areas, such as farms, ranches, mines, and energy industries for being located in rural areas. On a document that we found, we noticed that all these industries they rely heavily in healthcare facilities to try to retain their workers. About the data and thoughts. Well, as we mentioned it, we said that there were about 300 rural hospitals at immediate risk for closure. And also, we said that there's a limit of 25 million per fiscal year of the grants. That means that if you divide those 25 million into grants of $500,000, obviously $500,000, that means that you can only help 50 hospitals. So, in other words, this is not enough to help the 300 hospitals that are at risk for immediate close. According to the Center Health Quality Payment Reform, a common problem in rural hospitals is inadequate revenues to cover their expenses. Moving forward, uh, we found a letter. Uh, in October 2019, the ANA responded to with recommendations to a letter from the U.S. Department of Health and Human Services requesting information about rural health access care services. So this on this document, the ANA advocates for full practice authority for advanced practice registered nurses, emphasizing the removal of barriers in states with restrictive nurse practices rules. So, in other words, what they're suggesting is to give the APRNs or the advanced practice nurses, registered nurse, the ability to practice to the full extent of their education and training, and particularly in those rural areas to try to mitigate the problem or shortage of healthcare providers. About my personal position, as I stated before, the bill S 953 is just a quick fix for some rural facilities, but not enough to save all those facilities that are going through a crisis. I personally think that we need to look for initiatives with new models of fair payment for rural facilities, and also we need to consider the ANA suggestion about provide maximizing the use of APRNs in these facilities. I want to extend a little bit in regards of the new models for fair payment for rural facilities. According to some of the documents that we read, some rural facilities, they should be receiving a payment for the standby capacity payment, which means that they need to cover the cost of running the hospitals and staff, even when they are not helping a patients at that moment. So definitely we need to look for new initiatives with fair payments, and also advocate for APRN's practice. About the biblical perspective, in the Bible, there are principles and teachings that emphasize caring for the sick, helping those in need, and promoting justice and equity. Proverbs 31, verses 8 and 9 encourages speaking up for those who cannot speak for themselves and advocating for the rights of the poor and the needy. This can be applied to advocating for improved healthcare services and resources in rural areas where access might be limited or inadequate. Thank you for listening. If you have any questions or if you have any comments, please respond to this.